Hey there guys, it's Jonathan Lucero McKinney again. Thanks for coming back. I'm recording this today on Sunday, June 28th, and there's a lot that has changed with the COVID-19 pandemic around the world, in the United States a lot as well. Cases are spiking, things are happening, and there's a lot of things that are going to continue after this pandemic that are going to be just commonplace things. And one of those is a topic that I want to talk about today, which is telehealth and telemedicine. Visiting your provider virtually can pose a lot of new challenges, and you may not be comfortable with it. Maybe you're not the most comfortable with technology, and maybe it just feels weird to see your provider over a screen and really get that patient-provider connection. Whatever the reason, it's important not to get overwhelmed and realize that there is a lot of good that comes out of this. Before this pandemic, telehealth and telemedicine was pretty young. It was in its infancy, it wasn't used very much, but now that we have seen how it's being used and the utility it can bring, not only to the providers but patients, I think it's going to really flourish in the coming years. In fact, a big driver of what happens with healthcare policy is the Center for Medicare and Medicaid Services, or the CMS, and they are pushing for increased coverage and just all sorts of things with telehealth and telemedicine. And today, I want to give you an idea of how you can best manage telehealth and telemedicine visits. First tip that I have for you is to check and make sure that if you have health insurance, that telehealth or telemedicine services are covered. Now, I don't want to get into the weeds with insurance because it can be very confusing. As someone who's studying medicine, I'm still confused by it, and it's a work in progress. And I just want to preface this advice that the overarching theme is call your member services to make sure that you're covered. I know it's confusing, it's a pain, but you really should check before you get a bill in the mail. Okay, the second thing to keep in mind with telehealth is to just optimize your connectivity. You don't want to be lagging as your provider is talking, or you're trying to get an important point across to your provider. Make sure you have really good Wi-Fi or internet coverage. And to do this, what you want to do is turn off things that are taking up a lot of bandwidth on your network. So these are like GPS services or gaming devices, or even on your device that you're using to connect with the provider, whether it's a phone, a laptop, a tablet. Turning off things that you aren't currently using that could be hogging your internet usage. Also, some tips to make sure that your connection is strong: try moving closer to the Wi-Fi router, and that could increase the strength of your Wi-Fi. And if you have a device that has an Ethernet plug-in, consider using that and plugging an Ethernet cable into your device for a strong, reliable connection. All right, the next tip I have is that you should log in early and troubleshoot. Sometimes things happen, you may not be able to connect. Whatever the case may be, logging in early and making sure you have a good connection is paramount to make sure that your experience is a good one. Log in early to whatever the platform is that your provider is using to connect with you, whether it's Zoom or Skype or DoxyMe or whatever it is. Log in early and test the connection. Sometimes even features like Zoom or Doxy, you can check the connection and do a test run of the connectivity. It's better to be early rather than right on time so that you have a chance to troubleshoot. Okay, my fourth tip is to optimize your experience, right? So we've optimized our connectivity, but now let's optimize our experience. So for this, just sort of treat it as if you were going into an office visit, right? You want to minimize distractions. So that means going into an area where people aren't going to be running around in the background or causing unwanted noise. Also, I think it's important to set the camera an appropriate distance away from you, roughly 2 feet, and put it at eye level. So if you notice right now, what I'm filming is I have my phone on a tripod and it's right at eye level, about 2 feet away. You can hear me nicely, and hopefully you can see me nicely as well. The next thing you can do is just try using a pair of headphones with a microphone. You want to be sure that the provider can hear you and that you can hear them. Okay, so consider headphones. It's not a necessity, but something to consider. All right, tip number 5 is just have a backup plan. When you've logged in early and you've troubleshooted, maybe something goes wrong, you can't connect, your scheduled time comes and there's no provider or there's no connection. I think it's important to have the phone number of the office or the provider or whoever is managing this meeting just right next to you, just in case you need them. Technology is our best friend and sometimes our worst enemy. So don't panic, that happens. I'm sure that the provider has done it before. Also, while you're setting up this appointment, before this has ever begun, consider just asking your provider if there's an easier way to connect with them. There are a lot of providers out there that are using easy things like FaceTime or Skype, things that we use sort of every day that you may be already familiar with, that'll make it just so much easier to connect and have this most important appointment with your provider. Okay, and my final piece of advice really applies to both telehealth and also in-person visits, is just to come prepared. If this is a new issue, a new problem with new symptoms, consider writing a list of everything that's going on ahead of time so that you're not fumbling through what you want to say during the visit. Maximize the time that you have with the provider. You also just want to prepare a list of questions. If you take any medications that need refilled, have a list of that. Anything that you can possibly think to ask or want or need from the provider, have that ready. Also, some valuable information that your provider may want are things like your vital signs and your health measurements, like your height, your weight, your heart rate, your blood pressure, if you have a cuff that you can do it with. Having all of that ready before the visit, rather than doing it during the visit, will save so much time so you can focus on the things that you really want to. Now, this is very different, and depending on the type of visit for the provider, you may be asked to do some physical exam on yourself, pushing on your abdomen, holding up a rash to the camera, or even just feeling if there's swelling on your legs, pressing against your shins, looking for edema, things like that. So just kind of going into that, being aware that you may just be asked to help the provider determine what's going on so that they can tell you if you need to go in to see someone in person or if they can reassure you that everything is okay. Just being aware of that. All right, I think that's it. That's all I have. Telehealth, telemedicine, all of this, it's not going anywhere. I feel like it's only going to grow in popularity as we see the utility that it brings to the table. It saves you time in your day. You don't have to take off work. You don't have to worry about transportation or long wait times. You're simply there with your camera in a very comfortable environment with your provider. I really think if you use these tips that it'll make it just a much more comfortable experience. There's so much good that can come from it, and I really hope that you take these tips to heart. Thanks so much for watching. Please like, comment, and subscribe, and I hope this really helped you out. And until next time, bye now.